Hi, everyone. I'm Garth, and I just want to welcome colleagues, collaborators, friends, and partners joining us online, and those who are here in person in snowy New York City. I'll tell you, as someone who's born in Jamaica, it's always interesting when it snows. There are really a number of well-established and social and structural determinants of health, like housing and education, a lot of things that people like me and many of the folks in this room have spent their time working on. And they have proven to really have the significant impact on health outcomes. But the pandemic has highlighted a determinant that has assumed an increasingly important role in this particular digital age. Karen mentioned it before, and I'll reiterate it. That's information. Information is a determinant of health. What does that mean? It means it drives health outcomes. It drives the decisions that people make. It drives what people think about in their lives, and it drives our community's health. At Google, we have a responsibility as an information technology company to carefully consider how we can improve our products and ensure that we're positively contributing to health outcomes. And people are looking for information in the formats that they prefer. Today's world, that means video. In 2020 alone, Karen said this before, but I'll mention it again, YouTube had over 110 billion with a B, views on health condition videos globally. So we have to ensure you can find high quality information that you can trust. To raise up content that meets these standards, we launched two key features on YouTube I want to tell you about. One is the From Health Sources content shelves to highlight videos from authoritative sources. The second thing we did was health source info panels to provide real context to help viewers identify videos from authoritative sources. We launched these features in 10 countries, and in the US and Germany, we expanded these features to include individual labels around individual professions like doctors, nurses, and mental health professionals. Again, further give users and folks who are viewing this content cues in terms of how they can trust this information. But going a step further and building on the work of the National Academy of Medicine and the World Health Organization, today, we're really excited to announce the National Quality Forum has published a document in partnership with YouTube Health that identifies ways to advance the accessibility and use of online health information by really defining this concept of quality of health information, going beyond just information that's accurate, but engaging so we can pull people in so that they can understand the messages and really feel confident in how they act and how they react. And this guide is really about how individual health creators and folks who are developing content can develop high quality content across all health literacy levels. And it's really important to think about health literacy when we're thinking about our communities. We've done a lot of work to ensure you can find high quality information when you come to YouTube with health questions. But a lot of times people are coming to YouTube with a human question, like, how do I live with this? How do I deal with this particular challenge? And that's where we've gone a step further. And to find human answers to those questions, we'll launch a feature that shows a shelf of personal stories where people are talking about their life experiences. And it's relevant to certain health topics like cancer and maternal health and mental health. But YouTube is not only a place for patients and families to find information about their health and connect with broader communities. It's also a platform to help healthcare professionals keep up with the latest research and best practices in clinical care. So to help clinicians expand and refresh their medical knowledge and to meet those clinicians where they are along their education journey, we joined with Harvard Medical School to pilot a really novel approach to continuing medical education using YouTube. And for the first time, content on the HMS Continuing Education YouTube channel is eligible for clinicians to claim continuing education credits. Ultimately, this pilot will help clinicians take better care of their patients using video to really bring medical concepts to life. Looking ahead, we're trying to scale how we evolve our role in supporting continuing medical education, and we're working with the Accreditation Council for Continuing Medical Education to provide best practices for video production and content strategy that's going to really help augment the quality and delivery of impactful learning experiences for health professions. It's really important at this particular time that we're really able to meet healthcare professionals where they are with information and training in a very accessible way. So by lowering barriers to access and harnessing our experience in information sharing, YouTube is working to democratize medical education in a way that really hasn't been possible before. We also want to highlight the incredible and brilliant healthcare content creators on YouTube. We actually have one of them here today, Dr. Mike, who we kind of claim as one of the OG health content creators. And without creators like him and others, the platform just wouldn't exist.